All right, so this video is about contraception. All right, so contraception refers specifically to any methods used to prevent pregnancy. All right, so pregnancy prevention and STI prevention are not always the same thing. They can be, but they also have distinct purposes and don't always overlap. All right, so people will use contraceptive care for many different reasons. Could be for pregnancy prevention. Part of this is also family planning. So when you look at things like education, careers, family size, things like that. Other people will use it for menstrual regulation to help because sometimes there's abnormally high levels of pain or just to kind of regulate that a little bit. And then also to a certain extent, some STI prevention. But again, not always the same thing. Okay. When we look at the kind of the history of contraception, it's long and sometimes controversial. Right, so we look at things like legal restrictions that can still take place, religious opposition in many ways, medical information, unequal access, so on and so on. Right, there's a lot going on here, and unfortunately, what we've seen is that in many cases, some groups, especially marginalized ones, have experienced some negative sides to this. All right, so for example, during the eugenics movement here in the United States, we had forced sterilization. Right, so these were individuals in many cases who were deemed to have some type of mental disability, and then they complained of stomach pain, and while they were getting that corrected, they would then go and like tie the tubes of those women, all right, without their consent, without them knowing. They were forcing them to receive that care, even though they did not consent to it. So when we look at contraceptive care, one of the things that we want to consider are we have the right to have children, we have the right not to have children, and we have the right to parent safety. Right? So those are some of the considerations that we want to have. Now, as far as the actual methods of contraception, there are various ones. One approach are what are called the behavioral methods. Right? So behavior, things that you're actually going to do to try to prevent pregnancy. Here is where we're going to see some, at least in early times, some techniques that were based on superstitions or myth, things that people would do that were not going to work. So for example, after having sexual intercourse, women, in order to get rid of the sperm out of the vagina, would jump up and down, right? Or they would try to sneeze or cough really hard, right? So those aren't going to work. And so it's not an effective way, right? Within the behavioral methods, one of the most common techniques is just abstinence, right? So abstinence, if done and done correctly, then yeah, you're going to prevent pregnancy because sexual intercourse itself is not happening, okay? The other common behavioral technique we see here is the withdrawal method or pulling out. This can be very, very risky because if you don't pull out in time, semen can still make its way in. Or what we can see is that even before there's ejaculation, there's often what's called like a pre-ejaculate, and semen can actually be in that as well. So the withdrawal method isn't always the most effective. Okay. Then we have the barrier methods, right? So we want to create a barrier that's going to prevent the sperm from reaching the egg. Okay. So most common example here is the external or male condom, right? So this is put on the penis during intercourse to prevent any of the semen from getting out from that enclosed space, right? Now, there are some eternal ones as well that women can use, so like diaphragm, cervical caps, different things along that nature to do the same thing, prevent the sperm from reaching the egg, okay? With this, there are certain effectiveness rates, like how effective they can be. What we want to consider, though, is there's a difference between the effectiveness rate when there is perfect use, when everything's done exactly how it's supposed to, and then also what's called typical use, right? So we have to account for human error in those types of things. Okay, so those are the barrier methods. We also have hormonal methods, right? So these can include different things, vaginal rings, injections, implants, things like that. Most common, what we're going to look at here is birth control. Right, so it's an oral contraceptive that need to be taken, and it's going to have kind of the basic goal of preventing ovulation. And so we want to prevent it from happening. What it can also do, depending on the type of contraceptive that you're taking, It can do things like thickening the cervical mucus, right, making it harder for sperm to travel through, but also thinning the uterine lining, right? That's another possibility. Again, main goal, prevent pregnancy. Okay? What we'll see, though, is that some people may also take oral contraceptives because they experience painful menstruation, right? So when the time of the month comes and they're experiencing the period, it's very, very painful. And so oftentimes an oral contraceptive can help ease that pain. And it can also do things like preventing or helping with acne management. Okay, so that's something. With oral contraceptives, though, again, this is where we're seeing a difference between pregnancy prevention and STI prevention, because they do nothing to prevent STIs, right? They only reduce the likelihood of pregnancy. Okay. Another area that we're going to see are what we call long-acting, right? So the long-term but reversible contraception. Right? So the primary thing we look at here is an IUD. This is an intrauterine device, right? So this is something that's placed within the actual uterus itself, right? And usually it has some kind of chemical with it that's going to prevent the semen from being transferred, right? It's going to stop it. When we look at this, it's one of the most effective reversible methods because it can reduce user error, right? This is something that's placed by a medical professional, and once it's there, it can stay there for years. So we want to consider something like an oral contraceptive, that's a pill you have to take every single day, or an IUD that gets inserted into the uterus directly and stays there for several years, right? So it's like you do it, and then you don't have to think about it anymore until it's time to replace it. Okay? Right, and then we have permanent contraceptive. Right, so for men, this is a vasectomy, and for women, it's a tubal ligation. Right, so it is intended to be permanent, and this is more appropriate for individuals who are more or less confident that they do not want any future pregnancies. Right, they are not planning on having any more children, and they're very sure about that, and so they'll pursue one of those methods. Okay. Now, the thing that we want to consider is that no contraceptive method is perfect, right? So things that we should consider, effectiveness rates, what we talked about before with correct versus typical use, right? We have to account for human error. How accessible are these things? What's the cost? What are the side effects, right? Particularly the hormonal methods, they're going to have some side effects to those. And there's personal preferences, right? So as we consider those things, as far as what the best method might be for each person, might come down to health needs, lifestyles, the relationship context, comfort level, and what are the overall reproductive goals. Okay. So while pregnancy prevention and STI prevention are not the same thing, they can have some overlap, right? What we call dual protection. Right? So one of the things that we see for STI prevention, for example, to reduce that transmission, one of the most effective ways is the use of a condom. Right? So that way we can kind of see it's being both. Right? It's a contraceptive thing and it's an STI prevention thing. Where the dual protection comes in is we're going to use a condom plus another contraceptive method. All right? So for example, the birth control pill or an IUD and using a condom. Right? So there's two things happening. We're going to try and reduce pregnancy while also reducing the transmission of STIs. Okay. All right, so just two questions for us to consider with this one. What factors besides effectiveness might influence contraceptive decisions? Right, so a lot of times we consider things like culture and society, family, religion. Right, how might that play into someone's decision on whether or not to use some type of contraceptive use? And then with that too, maybe we can pull in how do social, or let's be more specific with political factors, how might that influence things like access to contraceptive care, right? So just some thoughts to leave us with as we talk about contraception.